everyone, I'm Sheila Suplig from BSN 2B, and for today, in this video, we're going to discuss and perform the return demonstration of cleaning a wound and applying a dry sterile dressing. The purpose of this procedure is to reduce the risk of infection and also to facilitate healing process. Before performing the procedure, it is important to first check for the medical's order. Verify the identity of the client.
Gather the necessary materials and bring it to the bedside table. The materials needed are non-sterile gloves, sterile gloves, wound cleansing solution, gauze for wound cleansing, 4x4 sterile gauze for wound dressing, scissors, and tape. Use the smallest size of dressing for the wound. Provide for patient's privacy by closing curtains around bed and close door to room if possible.
Perform hand hygiene and observe other appropriate infection prevention procedures. Hello, good afternoon, ma'am. I'm Sheila Suplig, your student nurse for today. Before we go on with the procedure, may I just verify your identity by stating your name and age?
I'm Suplig and I'm 18 years old.
Okay, so thank you very much. Today po, we're going to perform a procedure. So, lilinisan po natin yung wound nyo as well as change the dressing. It is performed to prevent infection as well as facilitate healing. So, along with the procedure, there might some uncomfortabilities that you might feel. So, you can just inform me, and I would also like to ask for your permission to perform the procedure. Would that be okay?
Okay, sure.
Okay, thank you very much. Rest assured that all of the data shared between us will remain between you and me as well as your attending physician. Before that po, may I just confirm your pain felt today? So, can you please rate your pain from 0 being the lowest as well, being no pain, and 10 as being the highest?
Today, siguro mga 7.5.
Okay, so based on the doctor's order, we may administer analgesics to reduce the pain before we start the wound healing. So we should wait for at least 30 minutes for the analgesic to have time to be effective.
Assist the patient to a comfortable position that provides an access to the wound area. Check the position of drains, tubes, or other adjuncts before removing the dressing. Put on clean, disposable gloves and loosen the tape of the old dressing if necessary. Carefully remove the soiled dressing, and if there is a resistance, you can use silicone-based adhesive remover or alcohol to help remove the tape. If any part of the dressing sticks to the underlying skin, you can use small amounts of sterile saline to help loosen and remove the dressing. After removing the dressing, note the presence, amount, type, color, and odor of any drainage on the dressing. Place soiled dressings in the appropriate waste receptacle. Inspect the wound site for size, appearance, and drainage, and assess if any pain is present. Check the status of sutures, adhesive, closure strips, staples, and drains or tubes if present. Note any problems to include in your documentation. Using a sterile technique, prepare a sterile work area and open the needed supplies. Open the sterile cleaning solution. Depending on the amount of cleaning needed, the solution might be poured directly over gauze sponges over a container for small cleaning jobs or put into a basin for more complex, larger cleaning area. Put on sterile gloves. In donning sterile gloves, Use the skin-to-skin and glove-to-glove technique to put on gloves. Clean the wound from top to bottom and from center to outside. Following this pattern, use new gauze for each wipe by placing the used gauze in the waste receptacle. Alternately, spray the wound from top to bottom with commercially prepared wound cleanser. Once the wound is cleaned, dry the area using a gauze sponge in the same manner and apply ointment or perform other treatments as ordered. If a drain is used in a wound location, clean around the drain. Apply a layer of dry, sterile dressing over the wound. Forceps may be used to apply the dressing. Place a second layer of gauze over the wound site. Remove and discard gloves. Apply the tape, Montgomery straps or roller gauze to secure the dressing. Alternately, many commercial wound products are self-adhesive and do not require additional tapes. Securing the dressing. Label dressing with date and time. Remove all remaining equipment and place the patient in a comfortable position. Ask for feedback from the patient and document all procedures along with the equipments used during the procedure. Perform aftercare for the materials and perform hand hygiene after doing the procedure. Check all wound dressings every shift and document regularly according to the reaction and results of the intervention or treatment performed.